you for asking me to be here this afternoon. My physician leadership experience has given me a perspective on both the problems and the potential of Americans' healthcare system. I see four key failures of our current system, which together have produced the excessive cost and quality gaps you've heard about. First, America has no cohesive, comprehensive health policy regarding coverage and access. We have failed to set either a floor or a ceiling for the care we will provide. Second, we have no cohesive, policy-driven payment model. We can't decide if we want fee-for-service or some type of bundled payment. We can't decide if we want a private system or a public system. And this mix of payment models has produced misaligned incentives and excessive administrative costs. Third, we have no comprehensive approach to the delivery model. We can't decide if we really love primary care because what we pay for actually is specialty care. We can't decide if we want siloed care or integrated care. Finally, we have no coordinated evidence-based regulation. In fact, dozens of entities regulate healthcare, adding to the confusion of providers and the cost to all of us. These problems have given us the healthcare costs and the quality gaps that you've heard about. These problems exist, but so does the potential to do something better. It's not a fantasy. There are American healthcare systems that show us what can be achieved. Denver Health is one such system. It is an integrated system composed of the 911 system, a large hospital with level 1 trauma center, 8 federally qualified health centers, a public health department, 12 school-based clinics, correctional care, a call center, and an HMO, and a staff of 250 employed academic physicians. Denver Health's care is supported by a sophisticated $310 million HIT system. 46% of its patients are uninsured, 70% are ethnic minorities. Despite this payer mix and a vulnerable population, Denver Health has achieved very high quality preventive, acute, and chronic health care. 92% of our one-year-olds are fully immunized. The hospital mortality is one of the lowest in the country. We have been in the black every year for more than a decade, in part by using the Toyota production systems you heard Gary Kaplan talk about. So there are models here in America that can inform the transition from the non-system to a high-performing health system. This transformation is urgently needed. The economic crisis is pushing us to finally act. From 2003 to 2007, Denver Health's uninsured care hovered around $275 million per year. In 2008, that increased by almost $40 million to $310 million, and based on the last quarter is projected to be $350 million in 2009. During 2008, the number of uninsured people who never previously used our system increased by 20%. Presumably, these are people who have lost their jobs or have now lost their insurance. This is not sustainable. We must use this crisis to finally develop a high-performing healthcare system. We need to go beyond talking about expanding coverage. That alone is not affordable, and it will by itself not achieve the quality or the value we want and we deserve. We must address the four failures that I noted earlier. Achieving transformation from our fragmented, costly non-system to a high-performing system will not be easy. It will take visionary and courageous political leadership, a willingness of all the components of the system to accept change and, in some instances, less profit, and all Americans to have an openness for something different. Thank you.